Headache versus high blood pressure. Separate fact from feeling with subjective versus objective. All right, so Stephanie here again with another video. I'm here to help you pass the medication administration program MAP test. Some places call Meditech. The link in the bio, you can go on the website, follow the playlist, but let's get right to it. Let's talk about subjective versus objective data, okay? So part of a MAP staff responsibility is to observe and record, or observe and report. So you observe things, you see things, you're taking in all your senses, and you write them down. You either report verbally or non-verbally by written form, but one information has to pass from one staff to the next, and then to the next, and so on and so on and so on. So you're not on call 24 hours a day, 7 days a week, nonstop, right? You go home, so the whole entire healthcare team needs access to information that you either gathered or witnessed. All right, so with that said, there are two types of information. Sorry, my arm's like itchy. There are two types of information. There's objective and subjective. So let's talk about objective. Objective information is quantifiable, meaning you can measure it, and everyone uses the same tool to measure, or you've gathered with your senses. So let's give examples. Vital signs, right? This machine has been calibrated and it's designed to take a blood pressure. So when you take a blood pressure, it's not like the patient says, I feel like I'm 180 over 42, right? I'm just making up numbers here. You measured it, and if you're skilled at taking a blood pressure, or that patient's blood pressure is 142 over 62, that is an observation, is quantifiable. These numbers have meaning. And so there's a science behind it. The temperature, the patient is 98.6, 99.1, 1.5. They have a fever. This is quantifiable, okay? Then your senses. You call and report, you call 911, what's going on? I found the patient with a huge bruise on their forehead. How big is it? What color? The bruise is bluish purple, and it is about the size of a fist. Okay, this is quantifiable. When they get to the emergency room, they're not expecting to see something green or orange or red or the size of a dime. Pretty much, if everyone looks at it with their eyes, maybe they might use more words to describe it, but they're going to see generally a bluish purple bruise the size of a fist. Okay, this is quantifiable, what you could see. Here, someone throwing up loudly sounds like projectile vomiting, the sound. Okay, I hear somebody weeping and crying. That's the reason you go in a room to see what's going on. So if 10 people were standing at the door and they could hear, they would all probably hear the same thing of somebody crying. All right, that's quantifiable. I smell, for example, stool. We even learned that in nursing school. Obviously, stool is not the best smelling thing, but if someone has an infection called C. diff, it even smells even more. So it's a quantifiable measurement for you to tell the nurse or tell the doctor that this stool has an especially foul-smelling odor, and most likely when they go to test it, the person has an infection, right? Okay, so there's numbers, measurable. Subjective is a feeling, okay? I feel anxious. It's not equal across the board to all people, because maybe I'm about to teach phlebotomy next week. Some people see a needle, they're about ready to pass out. That has produced anxiety in them. How do you quantify that? Other people skydive and jump out of a plane, right? So these things, these emotions, although valid, are never the same across the patient. You can't really measure. It's the person's self-report. I am reporting that I'm afraid. Someone's afraid, they see a little spider, they pass out, and someone could see a bed of spiders, like fear, anxiety. I feel upset. I feel scared. I feel anxious. I feel sad. All of these are valid. You should talk to the patients about it. You should report it. Obviously care for the patient, but these are subjective. It's how the person feels. So it's good to understand when you're writing what is objective and what is subjective. So I hope that you found this helpful. And pain, I always like to say to nursing students, pain could be a tricky one. If I say I feel pain, by me just saying I feel pain is subjective. What is pain for me? Again, some people cry over a little pinch. Some people have a higher pain tolerance. I have an extremely high pain tolerance. But when you look at the pain scale, if you've ever been in a hospital, there's a pain scale 0 to 10 with smiley faces, and the person picks it and they pick 5. Then once they add a measurement to it, you're able to quantify it. So your pain is rated at a 5. That is objective observation. Sorry, I lost my train of thought for a second. So I hope you found this helpful. They like to ask questions on objective versus subjective. Click the link to follow the playlist. I hope you enjoyed this. And if you want some more questions or to see a full lecture of all the content, click the link and you'll check out all of the stats there. All right, take care. Bye.